Kubor nakaslem jong unongsan Hima.
I would like to thank Shri P.T. Sokme, Shri Hima Shamplyang, Shri George Lingdo, and I hope I haven't left out anybody. Honorable members of the Meghalaya Legislative Assembly for having raised the short duration discussion on matter relating to the news item published in the Khasi Daily newspaper Maupur dated 17th August 2020 with the caption Pilut ka Jilla Daki Spa Klorban Yakun COVID regarding expenditure incurred in fighting COVID-19 pandemic. Sir, I'll just like to request that I be given some time in this. I need to go through the document that has been prepared because it has all the necessary breakups that most of the members have asked for, and then of course I have the additional supplementary notes for individual points also. So we are all aware that even the most developed countries and some of the more developed states of India have found it extremely difficult to counter the challenges posed by the onset of the pandemic. However, our government rose to the occasion and faced the challenges head-on. Till the month of June, we were the state with the lowest number of COVID cases. Since then, we have consistently been among the states with the lowest number of cases. The state made a conscious decision to provide the best possible care and support to citizens during these unprecedented times. Despite the falling tax collections and the shortage of resources, we have prioritized the fight against COVID and invested resources in a timely manner. Since March, we have ramped up our RT-PCR, TrueNat, CBNat testing capacity per day from 30 to now over 2,000. As of date, we have conducted over 2.14 lakh tests and are among the top states when it comes to the number of tests conducted per million of population. At a mortality rate of 0.9%, we are also among the very few states that have a mortality rate of less than 1%. In the last 7 months, we improved health infrastructure, provided generous relief to the most disadvantaged section of the society, made funds available to our honorable MLAs so they can take up relief work in their respective areas, and provided the best corona care facilities. In these extraordinary times of the pandemic, we rose to the occasion and did the things that every responsive government has to do, prioritized the lives, health, and well-being of all the citizens affected by COVID and of those whose lives have been disrupted by the lockdown. So all these interventions need investment of financial resources and has already been disclosed in the public domain. The state has spent 399 crores on the various health and non-health related aspects of management of COVID. This expenditure was made by the various departments of the government as follows. The Health Department, including Directorate of Health Services and NHM, number 1, 271.2 crores. Revenue and Disaster Management, SDRF Fund, 23.7 crores. Revenue and Disaster PM Care, 3.5 crores. Chief Minister's Relief Fund, 7.4 crores. CM Special Grant, 14.7 crores. Mining and Geology DMF, 8.9 crores. Labor Department, 51 crore. Community and Rural Development and Urban Affairs, SRWP, SUWP, 15.1 crore. Urban Affairs, 3.5 crores, total of 399. Out of the 399 crores of expenditure, bills have been paid of 251 crores and the pending liability are 148 crores. The government has tapped into various sources to make the COVID expenditure in addition to the state government's own resources. The following are the various sources of funds in addition to state's own sources. Number 1, National Health Mission, 43.4 crores. Number 2, State Disaster Response Fund, 23.7 crores. Number 3, Prime Minister's Citizen Assistance and Relief in Emergency Situations Fund, 3.5 crores. Chief Minister's Relief Fund, 7.4 crores. District Mineral Foundation Fund, 8.9 crores. Meghalaya Building and Other Construction Workers Welfare Fund, 12.9 crores. North-East Council, 3 crores. Member of Parliament Local Area Development Scheme, 1 crore. Total 103.8 crores. So I will now focus on some of the key items of expenditure and explain the rationale for making the expenses. Testing. Sir, I would like to inform you and the House that the state had to be dependent on Ngims for COVID-19 testing, and they were limited to 30 tests per day during the beginning of the pandemic. As of today, we have conducted over 2.14 lakh tests. Since the inception of the statehood, we have not had a single biosafety level 2 category lab in the state, which is required for testing viruses like COVID-19. So with a lot of pride, I would like to mention that in a span of 2 months, the state had established 2 such BSL-2 labs in Tura Civil Hospital and Pasteur Institute, Shillong. These facilities have conducted more than 52,804 RT-PCR tests so far and continue to do more. These facilities will stay beyond COVID-19, and the state will pursue to get them converted into biosafety level 3. As I had mentioned even yesterday in the House, the state is determined to not lose the opportunity this crisis has given to improve the health system. Testing has been established in all 11 districts of the state and Mairang subdivision. The state government has also assisted the private hospitals in setting up the testing centers so that the citizens may benefit, and the hospitals are also equipped to handle any such crisis. Sir, I would like to mention that the state, since the beginning, had supported Ngims more than once. Following are some of the items that were provided to them. RNA isolation kit, 32,500 numbers. Rapid antigen test kits, 4,400 numbers. RT-PCR detection kits, 3,000 numbers. PPEs and N95 masks as well have been provided. In order to promote access to masks and encourage the habit of wearing masks for all, various initiatives to provide free masks were taken by the state. These are reusable and cloth masks that are suitable to the environment as well. With the rise in the number of positive cases in the state government took a decision to conduct random sampling in high-risk areas such as marketplaces, containment zones, etc., to understand whether community spread had taken place. In order to do this smoothly, over 75 rapid response teams were created in the state. The recruitment for these units were done at the district level, and 407 health and related workers have been employed in these teams. They also help in managing the containment zones in their respective areas. Large number of additional manpower was also recruited for managing the testing, various other support activities at hospitals and other health facilities. The total expenditure on contractual and human resource is about 15 crores, and on testing, including lab and surveillance, is 38.9 crores. The Corona Care Centers. In order to strengthen our quarantine and isolation facilities, which was absolutely the only way initially known to stop the infection, Corona Care Centers were created in each of the districts. In total, we had up to 25 Corona Care Centers with a bed capacity of 1,205. I would like to again mention clearly to the House that these were set up apart from those already in place at hospitals. These Corona care centers were set up in record time. IIM Sauli, with a bed capacity of 201 beds, was the largest center during the time of inauguration in the Northeast region. There were no other such facilities with individual toilets for every occupant anywhere else. We have so far quarantined or isolated over 25,000 persons across the state. Each person, if under quarantine, would have stayed on an average for 2 to 3 days, and if isolated, would have occupied for 14 days. All these expenses were borne by the state. These Corona care centers are exclusively manned by over 916 persons round the clock, not to mention the doctors who are deputed from other facilities. There was a significant cost to the setting up of the CCCs and operating the same. An amount of 30.8 crores was spent on setting up and management of the Corona care centers. Isolation facilities and hospitals. Honorable Sir, apart from the 1,205 beds in the Corona care centers, there are about 601 dedicated isolated beds functional in 20 major hospitals across the state. These beds are exclusively from the beds that have been kept ready at CHCs and PHCs. Over 2,365 patients have been treated in these hospitals so far. The state is in the progress of setting up ICUs in Resubelpara, Makurwat, Bakmara, Pulbari, and Tura MCH to fill in the gaps. The invisibility and high transmissibility rate of the virus was a source of concern. There was a need to build health systems in order to deal with any impending surge. Before the pandemic, the entire state had only 4 ventilators, which have now increased to more than 200 ventilators, 75 of which have been installed and are ready. Quarantine facilities for health workers. Sir, as you are aware, our healthcare workers, including doctors and nurses, have been on the front line to help us fight COVID-19, putting their own lives at risk. To ensure proper quarantine facilities, various hotels and guest houses were requisitioned to suffice the requirement. Accordingly, an amount of rupees 2.67 crores has been paid to various hotels and guest houses. This also helped these hotels and guest houses to meet their committed expenses and ensure the job of the employees. Various protective equipments. Speaker, sir, I am sure that the House would agree that most of us had not heard of PPE, known as personal protective equipment, or even the N95 masks. The state had very minimal stock of PPEs, and not to mention almost zero N95 masks. It is also imperative to understand that due to the nationwide lockdown, the logistics of such essential medical equipments was severely affected. This was the same situation across the states, and Meghalaya was no exception. There were several unfortunate protests by the healthcare workers at hospitals in major states demanding for adequate such protective equipments, personal equipments. But due to our early procurement measures, we never faced any such shortage, thanks to the union government, which had relaxed the procurement norms for speedy procurements. The logistics had eased only after special cargo flights were arranged by the union government in collaboration with the Air Force and other flight operators. The state was in a condition to prepare during this period to face the situation that was coming. For decentralization of processes, health infrastructure at the district level were also ramped up, where testing facilities were also made available in various districts of the state. District hospitals were also provided with oxygen cylinders, ventilators, and other related equipments to meet the requirement of COVID treatment. Sir, I wish to place on record that the state was so well equipped that we were in a position to share 500 viral transport medias to the state of Assam during their surge in cases in Guwahati. We were also thankful to Assam for helping us during the initial phases of testing. Ambulances. So the state had purchased a total of 55 number of ambulances during this period to strengthen the referral transport system. We had also placed orders for mortuary vans for each district. 4 of them have already been put in place in East Khasi Hills, West Jayante Hills, West Karo Hills and North Karo Hills, while the rest are expected to be in place within the end of the month. Of the existing 158 ambulances across the state that include 108 service ambulances, 25 were placed and 30 more were added to various facilities across the state. Sanitization. Speaker sir, I am sure that none of us had to use so much hand sanitizer in our entire lifetime. From being a product that was used only by a negligible populace in the country, it had suddenly become the most wanted product. We had to provide sanitizers liberally to all our healthcare workers and other service providers in order to bring about a behavior change and also to bring confidence in them while being on the field. Apart from this, so many institutions had to be sanitized regularly for clinical and psychological reasons. This started with the Secretariat, Corona care centers, containment zones, market areas, health facilities, including Ngims, etc. There were hardly any service providers for these purposes when the pandemic hit us. It wasn't an easy task to mobilize such personnel on such short notices, particularly during the lockdown. There was so much fear and misinformation that there were hardly anyone willing to wear a PPE and perform these activities. However, we have overcome these situations after a lot of planning and effort. Sir, in addition to the different direct health-related expenditures, we also incurred expenditure on providing relief and the much-needed support to the various sections of the society in the last few months. A number of these interventions were taken up in tune with our philosophy of creating a sensitive and responsive government. Some of the important interventions are as follows. Stranded citizens and returnees. Honorable Speaker, sir, as all of us are aware, there were thousands of residents of the state who were stranded outside the state and wanted to return home. As they could not return owing to the lockdown, the government decided to provide a one-time cash support of rupees 3,000 to a level of 10,049 for such stranded citizens. These citizens included students, working professionals, migrant laborers, and others. A total amount of 3.01 crores was incurred on this intervention. When the unlock process started, the government arranged for 14 special trains from all over the country, including Chennai, Bangalore, Mumbai, Delhi, Hyderabad, Gurugram, Kerala, Goa, Gujarat, and Rajasthan, for bringing back our stranded citizens. These citizens were then transported by bus from Guwahati railway station to their homes and quarantine locations. The state government also arranged for buses for all the northeastern states to bring back the stranded citizens, and for this, an expenditure of 2.85 crores has been incurred till date. A huge infrastructure was also put in place for screening and testing returning citizens. Detailed logistics were made for each returnee from their point of pickup at the railway station, providing them with food, screening them, testing, and quarantine at designated centers. It is also to be noted that the testing at entry and before discharge and logistic expenses for the returnees were borne by the government. All the returnees, until the rapid antigen tests were made available, were tested by RT-PCR. Provision kits. Provision kits consisting of essential items like food grains, pulses, toiletries, etc. were provided for those undergoing home quarantine. These kits and supplies for a family of 5 members for 14 days. The district machinery and various teams reached out to every quarantined household to ensure that provisions were made available to them. a total of 32,555 kits were distributed throughout the state. Accordingly, an amount of 6.11 crores has been incurred towards these expenses. Community quarantine centers. One of the success stories of our COVID management is the involvement of our communities in every aspect. Our communities also had to be supported so that they are able to redouble their efforts in dealing with the pandemic. Accordingly, an amount of 1.5 crores paid at a rate of 10,000 per community quarantine center has been spent. Relief to building and other construction workers. In order to mitigate the distress faced by building and other construction workers and to compensate wage loss on account of the shutdown due to COVID, the government has extended a monetary grant of 1,000 per beneficiary per week for 3 weeks to all active and registered beneficiaries for the period starting from 23rd March 2020. An additional amount of 2,000 each was also subsequently approved for payment to the active and registered workers as COVID compensation allowance. The total expenditure incurred for all the districts in the state is 12.9 crores. Relief to unregistered workers against wage loss. Sir, as you're aware, laborers across the country were rendered out of work and there was deep distress because of this. The government of Meghalaya did not want such a situation to arise in the state and therefore launched the Chief Minister's Relief Against Wage Loss scheme in order to provide relief to these people. Under the scheme, relief payments for 3 weeks were approved for payment to each eligible wage earner, laborer, petty trader at the rate of 700 per week. Accordingly, an amount of rupees 38.1 crore was transferred to the eligible claimants. MLA scheme. So we also wanted to give the honorable MLAs more flexibility to provide relief and support to their constituents during the very difficult period of the lockdown. Accordingly, we amended the guidelines of SRWP and SUWP and provided 25 lakhs per MLA to take up related activities to COVID relief. Sir, in conclusion, I would like to reiterate that the government did not spare any effort or leave any stone unturned in dealing with the pandemic. Our efforts were appreciated across the board, including the World Health Organization, which commended the state's approach towards managing the pandemic. During the meetings that were held under your chairmanship to discuss the pandemic, the honorable members of the opposition had also appreciated and showed satisfaction in the way our government had handled the crisis. Independent journalists, our students who had returned, residents of our states who happened to come here have placed on record their appreciation and sensitive support that Meghalaya has shown. Sir, we have given utmost priority to saving human lives, preventing the spread of the pandemic, and alleviating the discomfort of lakhs of our citizens. Despite the urgency and the unprecedented nature of the crisis, the expenditures were made carefully and following the due process. Through the various COVID-related interventions, we were able to reach out and support about 5 lakh individuals of the state, almost 15% of the state's population. Given that the pandemic is far from over and given the context of the second wave of infections and lockdowns in several European countries, I feel confident that this government has made the right investments which not only protect us in the last 7 months, but should also keep us in good stead in the coming months. So apart from this, there were a number of other issues that were raised by the honorable members, and I would just take a few minutes to try and address some of the issues that were mentioned by them. So I think the first issue I would like to just touch on, of course, with the outset, sir, I must say that whatever has happened in the past 8 months has been unprecedented, number one. And number two, sir, we have seen the response come from every section of society. And we have been able to come so far only because of the efforts made by everyone. And I think I would place on record, especially my appreciation and thanks to the frontline workers, because this has not been easy for them. You can imagine working for a month, 2 months like this, but going on for 7, 8 months every single day is mentally a big challenge, and it's not easy for them to do. I must place on record the work being done by the frontline workers, and of course the officers who have really put in a lot of effort to make sure that we were able to, a large extent, contain the situation. So regarding the lockdown that was mentioned by one of the members, I think nobody really, at that point in time when it hit us in March, lockdown was the only option that we had at that point in time. And we have seen this in history, even during the Spanish flu. When this happened, lockdown was seen as one of the main ways in which we could contain the situation. And obviously, we all understood that lockdown is actually a way to give us the time to prepare for the next coming months. So really, we looked at lockdown at that point also when we had lockdown, that we would get the time to, number one, contain the virus from spreading too fast, and number two, prepare our system so that we get ready, that when we do unlock, then we are in a position to handle it. And I think we must also appreciate the fact that when this hit us, as was being mentioned by one of the members, I think it was Honorable Member for Mausangram, that it was a sudden shock. And a lot of things were not clear as to how we will move forward and what steps to be taken. So in such situations, government has to take a decision. And sometimes we look back and we say whether the decision is right or not. But if you put yourself in that position at that moment, you just don't know how things will unfold in the future. So we had to take a decision, and we took it. And I think looking back at the entire process, I feel that it was the right decision that has been taken, and it has shown its impact, and we have been able to contain the situation to a large extent. So there was a mention about the fact that the COVID management committees had not received some funds. So the COVID management committees have, most of the COVID management committees, I should say, and we had stressed on the active ones in the beginning. So there could be a chance that there were some that were non-active. But almost close to 1,521 community quarantine centers received the money from the Chief Minister's Relief Fund, if I'm not wrong. Yeah. So the COVID management thing, so there could be, so it's a massive exercise with multiple things happening. There is a possibility that somewhere we missed out few community centers. It's not on purpose, but you can imagine the kind of work and pressure that people were under. Still, we managed to cover most of the areas. And if there are any shortcomings, sir, everybody's a human being, and a system and a task that we were doing at that point in time, the kind of coverage that we had to do, the kind of pressure that people were under, and there could have been one or two slips, but I think that was not intentional. And if there are any situations like that, we would be very happy to rectify that. And also, sir, that's the reason why we ensured that we had support from all angles. So if we could not get it through the COVID management, these committees could not get it through the Chief Minister's Relief Fund, we had given 25 lakhs to the MLAs, so the flexibility was there for them also to be able to help. So all these aspects were balanced out so that somehow or the other, the individuals would get the help. So regarding the one point that was mentioned by Honorable Member from Mausangram, regarding sodium hypochlorite. So I would like to just clarify to him that the amount that was spent on this was only 1 crore and not 8 crores. And we had bought about 37,000 liters with that. The rest of the amount which was mentioned by him was actually spent for disinfecting and for sanitizing different buildings and centers. And as was mentioning in my reply, that at that point in time, it was so difficult to find anybody to do anything. And even if people wanted to do it, their communities and their families would not allow them to come out and go and do the work. So we had a major challenge in getting the manpower to be able to do this. But nonetheless, we had to spend money, and we managed to get it because it had to be done. It was almost like a war-like situation. And we had a lot of challenges. And looking back, as I said, it is more important that we save lives and we don't give anything to chance. And that at that point in time, we made the decision that we will keep our focus and our objective very clear, which is to keep our people safe. and health will always be the priority. And that is why we made the decision at that point in time. But the numbers that was mentioned by Honorable MLA, I just wanted to clarify on that aspect also. And as I was mentioning in my reply, sir, that there were a lot of people who were recruited. That's absolutely right. We had to recruit people because we could not let the deputy commissioners and the ADCs and the officials from the PHA department, PWD department to run the COVID management system. So we slowly started. In the beginning, of course, we had to because we had no choice. But as we managed to move further, we started to outsource and get new people to manage certain parts of the responsibility and the work so that our officials could be free to do the normal work in governance. So in that process, hundreds of people were recruited. I think I mentioned about 400, 500 were recruited. But these were again recruited through proper process. And there were interviews that were held. In fact, I think you remember that in one interview, there was a positive patient that came in Nongpo, if I was not wrong. And it became a big issue, sir. So we followed the process under the given circumstances and we tried to resolve the issues as much as possible. So regarding the construction workers, so I can tell you that the unregistered laborers. So we had, in fact, when we started the process, our Honorable Deputy CM and the other officials had told us that we will be having approximately 90,000 to 1 lakh people is what we expect. And that's the reason why we said, let's go ahead with this because people need help. So by the time we started a registration process, by the time we started asking the BDOs and other officials at the grassroots level, the district level to send the information to us, we came out with a figure of 2,33,000. And then ultimately when we again screened these numbers, we came to know that almost 40,000 of them were duplicate records. So we then removed those 50,000 and we came up with a 1,81,000 number. My point being, sir, is that a lot of due diligence in a limited time and under tremendous pressure, while so many things were going on, this exercise was completed. And yes, the time frame was short. We had to move very fast. We could not reach out maybe to 100%, but I think whatever help we could give to whoever has gone directly to these people. And as I said, the selection process has been done in a very meticulous manner. And I'm happy to hear from the honorable members that these provision kits that were given, again, a large number of provision kits were given, sir. And I'll just tell you, so we spent about 3.29 crores in this provision kits that were given to the family members. And this again was done through the Chief Minister's relief, no, not relief fund. This was done through the Chief Minister's special grant. So under the special grant, we had started doing this. And sir, no other state, I think, no other state, as far as my knowledge goes, has done this exercise. We are the only states who did it. And it's kind of satisfying to hear the complaint coming from the honorable member who had mentioned that how come these people did not get? It means that it really mattered and it really made a difference. So yes, it could have been that few people did not get it because of maybe the logistics and the fact that the exercise was so big. But I think the effort has been appreciated. And as I said, our state is the only state which has actually gone ahead and given this kind of provision kits. I mean, I'm not aware of any other state that has done that. Apart from that, sir, regarding the aspect of the COVID management that we had done, so we had a state response team which was being mentioned. And so the state's response team really was only to integrate and monitor the entire process that's taking place to ensure that there is a body or there's a team that actually looks at all the aspects of testing, entry, protocols, all these aspects. Because the expenditure that was done had to be done by the respective departments. You cannot expect the state response team to end up giving money to the laborers because it can't be done by them because they don't have the information, and more importantly, it would take too much of time. So the departments had to deal with it, and obviously finance was coordinating the entire thing. So therefore, it's not that things were happening in a haphazard manner. There was, if you recall, so we were informed in the meeting also that during the first few days of COVID, in fact, the first 3 months, we used to sit at Chief Minister's level every day at 3 o'clock, including Saturdays and Sundays. So about 3 months we met every day to review the COVID situation. And so what is money is being spent where, how things are happening, overall control, overall the trains, where have they reached, have they left or not, how many students are there. All this exercise was happening at my level, at the Chief Minister's level, and we were monitoring this. So therefore the coordination was being done at the top, and including the expenditures was being done by the finance department. So therefore the state response team had its role to play, but when it came to the financial expenditures and all, most of the expenditures, in fact, were being coordinated by the finance department. Expenditures were made at their level. And of course, the SDs have come in. These are all expenditures which needs to be regularized, as we know. So the budget provisions are there only for a certain amount. And when we realize that this amount is not enough to meet this particular expenditure, we had to spend, but now we have to regularize it. And so therefore, the SDs are coming in. So I think that aspect also I thought I'll clarify. Regarding the Industries Department making the masks. So this was an effort that was being done by the Industries Department to promote the self-help groups. We gave this money to all the self-help groups of our state. Our women and the self-help groups who made these masks, they were given this money which went directly into the economy. So we realized that that's a win-win situation. So if we buy the masks from the market, maybe the money will go to outside companies, as was being mentioned. But by ensuring that the self-help groups make it, we'll get the masks also, at the same time they will also get a livelihood. So this 3 crores that was spent on the masks was actually done from a employment, or you can say livelihood perspective, and a win-win situation. And Industries being the department that is handling these aspects, we routed the money through the Industries Department at that point in time. But as I said, this money went directly to the self-help groups of our state, which is our women and other groups. And I had already mentioned, sir, that yes, there are pending bills that are there. So the 3.99 crores, 399 crores is the total expenditure. And out of this, cash payment or whatever payments, not cash, I'm sorry, payments that have been made to these, against these bills is to the tune of 251 crores. So we still have 148 crores which is due. So therefore, we have not given the entire 399 crores yet, sir. So therefore, I think there will be some individuals who have not received. And there are multiple reasons for it. Sometimes there is a delay in the paperwork. Sometimes the departments have to coordinate. The departments actually are so busy with the work at the grassroots level that they cannot finish the paperwork. So these challenges are something that don't come out in the open. But I think when you're in the office, you will realize and see that these teams have to really work in a very, very difficult situation. And therefore, there could be delays in certain instances. But whenever we come to know about these delays, we ensure that we push the departments to make sure that the most important expenditures and small expenditures especially for our local suppliers is met. So if there are any such suppliers, please let us know. We will move things fast. As I said, it was like a war-like situation. It still is. And we are fighting a very difficult situation. And in this situation, as I said, we have done our best, and I feel the response has been tremendous from everyone, and we've been able to contain the situation to a large extent. Sir, I think the honourable member who had initiated the discussion had asked a number of questions on all details of all these, district-wise and the hotel bills and the ASHA workers. I think it's worth mentioning the ASHA, sir, because I also agree that it's an important part of it. So regarding the ASHA, sir, rupees 1,000 per ASHA since January 2020 has been paid per month over and above their normal incentive. So this is an additional amount. So it's been 10 months now. So we have given 10,000 per ASHA additional has been given so far, and there are 6,804 of them in the state. So we have taken note of that. We have tried to help them out with the limitations that we had. And sir, as I said, the details of the expenditures that they had wanted, I think it'll be more appropriate, sir. I can put down in a breakup of the points that the honourable member from Maulai had mentioned, and I can place it on the table of the House, because if I go through all of it, so it's going to be really long. I mean, we have the vehicles. Just to give an idea, the Chief Minister's Relief Fund, because it's something that I deal with directly. So we have received 10 crores 35,000 rupees till date. And we have bought 25 ambulances for 108 amounting to 4.5 crores, 3 biomedical wastes amounting to 38,65,620, purchase of 10 eco ambulances at the cost of 47,77,480. We have paid for the community quarantine centers to all the deputy commissioners through the Chief Minister's Relief Fund at 1 crore 52 lakh 10,000, and we have paid for an additional 10 ambulances, eco ambulances at 47 lakhs again 77,480. So we have spent about 7 crore 36 lakhs 30,580 rupees from the Chief Minister's Relief Fund, and obviously we are left with another rough, I don't know the exact amounts, but it's about 2.64 crores approximately still left with us. So like that, we have all the details in the breakup. I don't know whether we will have the time to go through all of that, but as I mentioned, sir, I think it'll be making much more sense if I place it on the table of the House. Everything from the school fees, the ambulance, the CMRF, the different bookings of the trains and the flights, the infrastructures in the hospitals and the COVID centers, the hotel bills that he had mentioned about. So all of this is there, sir, and I think I'll place that in the table of the House. And so just to conclude, I would like to say that we must all appreciate the fact that we never faced a situation like this. And therefore, for one to just simply look at this as a normal situation and, looking back at the whole thing, saying that, well, this could be done this way, this could be done that way, I think it's easier said than done. When the situation demands for certain decisions to be taken, we don't know what's coming forward. But all we know is we need to do the best to take care of our people. And we did that. And I think the justification for all these aspects are there. When we were in the month of March, and everybody wants the offices to be sanitized. Everybody is looking for the PPE. I had like hundreds of suppliers who came to me saying that I can supply you PPE, I can supply you PPE. And I mean, we were like going crazy trying to understand what's happening. So in those situations, it's very difficult, sir, sometimes to really say that whether we can follow the due process, because as I said, we followed the due process in almost all the cases. Government of India, in fact, had allowed the states to So Government of India had allowed, sir, on 27th of March, saying that for procurement, the prevailing health emergency requires immediate procurement of certain items in quantities which may not be available with a single supplier or within the time frame in which they are needed. There is also a possibility that some items may not be available in the country in sufficient quantity within the time frame in which they were needed. Certain items of equipment are currently in global short supply and are effectively in a seller's market, in quote. There are also variations in specifications within the same category of items, and hence price differences may sometimes reflect differences in the specifications of quantity. In view of the urgency involved in the procurement of medical and other essential supplies, where time is of essence and delay may result in loss of lives, the following special instructions are issued for any emergent purpose related to COVID-19 purchase. The provisions of Rule 149 will not be applicable to purchase made under Rule 166 or Rule 204. So, I mean, I'm just trying to tell you that even Government of India, MHA, realized the situation at that point in time and give specific orders to the state, relaxing the norms through which you can make procurements, keeping in mind the health conditions and the health situation that we're facing. So therefore, this is the kind of situation we faced, and we did our best. The numbers are open. Anybody can come and see every single rupee. There is no question of hiding any facts or any numbers in this, sir. And as I said, I will place in detail all the points that were mentioned by the honorable members on the table of the House, sir. With these few words, sir, I'd like to resume my seat. Thank you, sir.
Sir, one small clarification, sir.
This is just a short
addition. Yes, sir. Just one small one, sir.
Just one small one.
Yeah. Sir, I have just two issues. Number one, I would request the Honorable Chief Minister to kindly just get back into the papers which have been supplied to him relating to the bills of 8 crore 30 which I had mentioned, sir. Sir, I have details with me also. My details speaks very clearly about the item supplied. It says sanitation, turnkey work including sodium hypochlorite, transportation, protection gears of designated places. And this whole amount, there are about 4 or 5 bills all accumulated together. That has come to 8 crore 30 lakhs, that one that I have mentioned. So therefore, sir, my stand is still the same. Like Honorable Chief Minister mentioned that the purchase of sodium hypochlorite is only for 1 crore. But I say, my figures also I have obtained. It says, I will not mention the names of the firms, but it says work order number and date nil. And then it says bill number, then it says item supplied, sanitation turnkey work, including sodium hypochlorite, transportation and protection gears. This is just for 2 months, the whole amount came to 8 crores 30 lakhs. So second point is relating to the appointment. I appreciate that the government is doing its best, and I have already appreciated whatever work that the government has been doing to contain the pandemic. Sir, my only issue is, please appoint people, no problem. But the process of your appointment, as Honorable Chief Minister said, we are maintaining the due process. I appreciate it. But how 2 people from outside the state have found their place in the office of the NHM? I'm not trying to get personal at anybody. But these 2 persons have been brought by the MD NHM, and they are from outside the state. If they have cleared the tests in due process of recruitment, I have no objection. But if they have just come from the back door, then they have to be removed immediately. That's all, sir. Thank you.
Sir, so first of all, I would like to once again clarify that the Honorable Member himself has now admitted that the 8 crores that he mentioned was for sanitizing various affected buildings, protective gear, transport, including sodium hydrochloride. The reason I had to clarify this is because he was then dividing the 8 crores divided by 100 rupees per litre, so there should be, I don't know how many lakh liters should be there. So that was a wrong calculation. So it should be divided by the 1 crore. So therefore, he was trying to, magnify the whole thing by dividing only 8 crores. So out of the 8 crores, only 1 crore was spent on hypochlorite, and you need to make the calculations accordingly. That's the only thing. That we wanted to clarify. Let me just reply. Let me just reply.
For transportation, sir?
Yeah.
7 crores.
Honorable Member, please let the Chief Minister reply, please.
So no, that's what. So, and it's a transport and also sanitizing of various buildings. Sir, if you recall during that time, everybody wanted the road to be sanitized. Everybody wanted their house to be sanitized. We had to sanitize Bethany Hospital 100 times. Secretariat had to be sanitized. I mean, and at point in time, we couldn't find people to do that job also. As I said, people were not ready. So it was a very, very complicated situation we were facing. So therefore, this 8 crores includes the sanitization of the buildings and the transportation and the protective gears and the sodium hydrochloride. So I'm just saying that he should not just single out the sodium hydrochloride. Number 2, regarding the appointments that were made, sir, the processes are being followed at all levels. And including, I think, the people who, obviously, sir, for the state government, we are ensuring, we have employed maybe 500, 600 people have been recruited now. And we're very happy that our own boys and girls are getting job. And that's part of the entire economic process also that we'd like to follow, that we're realizing that people can be recruited in this fight against COVID and our people will get a job. So it has been the very clear objective of the government to do that. And as for the information that has been provided to me, that the individuals, because I don't know the individuals he's mentioning about, but there are a lot of service providers who have been given certain parts to do. Like, for example, we have some people who are helping us with the IT part, some people helping us with certain other technical part. So these individuals who have come from outside are people who have been brought in by these in the service providers. And that is not in our control. We have given and outsourced the work to the service providers, and they can get local people or they can get people from outside. That's not the government's recruitment. But from the recruitment that we have done, number one, we have followed the process, and number two, we have ensured that our local people get the work.